Myself Dr. Gunjan, and we'll be continuing our series on menstruation, and today we'll be discussing about the phases of the menstrual cycle. Now, in a menstrual cycle, the basic changes occur in the ovaries and the endometrium. So we have an ovarian cycle and an endometrial cycle going side by side. First coming to the ovarian cycle, and in this, first the recruitment of the follicles occur, followed by selection of one dominant follicle among them. Subsequently, this dominant follicle will ovulate. So ovulation occurs and the follicle will now form corpus luteum. The follicle will be converted to a corpus luteum, and subsequently degeneration of this corpus luteum occurs. So this completes our ovarian cycle, and we'll be discussing each of these in details. And in the endometrium, the regeneration of the endometrium occurs, followed by proliferation of the endometrium, followed by the secretory phase, and thereby menstruation occurs. So both these go side by side. Now we'll first begin our discussion with the ovarian cycle and the recruitment phase of the ovarian cycle. Now what happens? A cohort of follicles, they undergo the process of development and differentiation, which takes around 85 days. So it takes around 3 ovarian cycles, or roughly 3 months, for one follicle which has been recruited to grow and become a dominant follicle. So important question here. Then the second important point is that the initial recruitment and the growth of primordial follicles, they are not under the control of any hormone. Again, this is an important question. Initial recruitment and the growth of primordial follicles, they are not under the control of any hormone. When this primordial follicle, they become around 2 to 5 millimeter in size, then the growth and differentiation, they are under the control of the hormone FSH, that is the follicle stimulating hormone. Now we have discussed that this follicle stimulating hormone, it prevents the atresia of the follicles. So the follicle which are not rescued by the FSH, they undergo atresia. Now around day 5 to day 7 of the menstrual cycle, one of the follicles, it becomes dominant. And what determines that which follicle will become dominant? The follicle in which the granulosa cells, they contain maximum receptors for FSH. The follicle in which the highest antral concentration of estrogen is there and less of androgen is there. So a follicle with estrogenic environment and maximum FSH receptors will become the dominant follicle, because this follicle, it will be rescued by the FSH, and the rest of the follicles which are not rescued by the FSH, they will undergo atresia. Now once the dominant follicle is selected, it keeps on growing under the influence of the hormone follicle stimulating hormone. It helps in the growth of the follicles, and at this time the granulosa cells surrounds this oocyte to form cumulus oophorus or discus proligerus, and the cells adjacent to the ovum, they are arranged radially to form corona radiata. Then the third important thing that happens during this phase, that the FSH, it induces LH receptors on the granulosa cells of the dominant follicle, and this will finally help in the LH surge, and subsequently ovulation will occur. So let me explain this by the diagram. So you can see here, this is a mature Graafian follicle, and from outside to inside, let us see the layers. The theca externa is there. This you can see here, this is the theca externa. Then we have the theca interna inside it. Then there is a separating membrane, that is called membrana granulosa, the separating membrane between the theca cells and the granulosa cells. It is membrana granulosa. Then inside it we have these pink cells. These are the granulosa cells. Now I told you that as the follicle grows, this granulosa cells, it comes and surrounds the oocyte. You can see here, this granulosa cells have come and surrounded the oocyte to form the cumulus oophorus, or it is also called a discus proligerus. And the cells which are just adjacent to the oocyte, they are arranged radially and they are called corona radiata. So even these are the granulosa cells which are adjacent to the oocyte. Then this is the oocyte, and the oocyte is surrounded by a zona pellucida. We will be discussing this. And this white structure, this is the antrum or the cavity, follicular cavity filled with fluids. Now, along with the changes in the entire follicle, changes also occur in this oocyte. So, let us see what happens. Now, this oocyte, it enlarges. It starts becoming bigger. It is surrounded by a glycoprotein layer, the zona pellucida. You can see here, this is the zona pellucida. This in blue, this is the zona pellucida, a glycoprotein layer surrounding the primary oocyte. Then we discussed that the granulosa cells, they come and surround this oocyte to form cumulus oophorus or the discus proligerus, and this basically anchors the ovum to the wall of the follicle. And among this cumulus oophorus, the cells which are adjacent to the ovum, just near to the ovum, they are arranged radially to form the corona radiata. You can see here, these are the cells which are arranged radially and they are called corona radiata. And here, this is the basic ooplasm containing the germinal vesicle and the nucleus. So, this is the structure of a primary oocyte. Now, we have seen till now that the recruitment of the follicles have occurred, then the selection of the dominant follicle has occurred, and this dominant follicle, it has started growing. So, from day 1 to day 14, these follicles keep on growing, finally leading to the formation of mature follicle, which is 18 to 20 millimeter. And this is just before the ovulation. Now, in the meantime, this follicle stimulating hormones, it keeps on acting on these follicles, and from the granulosa cells, the estrogen is released. We have already discussed that FSH acts on the granulosa cells to release estrogen and inhibin B. And this estrogen, in turn, it has a negative feedback on the FSH, it has a positive feedback on LH, and it causes proliferation of the endometrium. So, you see here that in the ovaries, the growth of the follicles are occurring, and along with this, in the uterus, proliferation of the endometrium occurs. So, the proliferative phase of the endometrium. Now, please try to understand these hormonal interactions, because once you understand, you will be able to answer many questions that come from these chapters. So, you see here, in the ovaries, the growth of the follicles are occurring, and along with this, in the uterus, the proliferation of the endometrium is occurring. So, the proliferative phase of the endometrium. Now, after the follicle has become 18 to 20 millimeter, the next step that has to occur is ovulation. So, let's come to ovulation. And the basic thing that was occurring in this ovulation is that the first meiotic division is completed so that a secondary oocyte and a first polar body is released. The secondary oocyte, it contains the haploid number of chromosome along with the maximum amount of cytoplasm, whereas the first polar body, it contains the haploid number of chromosome along with minimal cytoplasm. Now, for this ovulation to occur, let's see the hormonal interactions. And the basic thing that is required for this ovulation to occur, thereby it will lead to LH surge. So, with a sustained peak of estrogen, the LH starts rising, and this LH peaks in another 24 hours. So, it takes 24 hours for LH to peak. And 10 to 2, what are the things that we can conclude from this? So, ovulation occurs 32 to 36 hours after the estrogen peak and the LH surge, and 10 to 12 hours after the LH peak. So, all these are important questions. So, let's revise once again. There is sustained estrogen peak for around 48 hours. This will lead to positive feedback effect on the LH and subsequently leading to LH surge and LH peak. And it is because of this LH surge that there is completion of the reduction division of the oocyte. That is, the meiosis 1 is completed, leading to the formation of secondary oocyte and one polar body. Secondly, it initiates luteinization of the granulosa cells, and from these luteinized granulosa cells, there will be synthesis of small amount of progesterone and prostaglandins. Now, I have already told you that when there is small amount of progesterone, small concentration of progesterone, then it leads to positive feedback action on the LH and the FSH, subsequently increasing the LH values and the FSH values. Whereas the high concentration of progesterone, it has a negative feedback action on the LH and FSH and subsequently decreasing both the FSH and the LH. So, with the LH surge, there is luteinization of the granulosa cells and small amount of progesterone and prostaglandins are released, and the small rise of progesterone, it has a positive feedback action on the LH and FSH. Subsequently, the FSH and the LH levels, it will be increased. This increased LH level, it will further add to the LH surge, whereas the increased FSH levels, it increases the plasminogen activator. And this plasminogen activator in turn helps in the conversion of plasminogen to plasmin. And it is this plasmin which helps in the lysis of the wall of the follicles, thereby leading to the release of oocyte. So this completes the ovulation. So you see here that the combined LH, FSH and estradiol, they are responsible for ovulation. So mid-cycle surge of all these three hormones occur, subsequently leading to ovulation. So this completes ovulation, and now the next step is the formation of corpus luteum. So let's move on to the formation of the corpus luteum. So after ovulation, what happens? I told you the primary oocyte is converted into secondary oocyte, and the follicle converts into the corpus luteum. Now this corpus luteum, it starts growing under the effect of LH. Try to recall here that the follicles, they were growing under the effect of the hormone FSH. Now this corpus luteum, it starts growing under the effect of hormone LH, the luteinizing hormone. The corpus luteum, it keeps on increasing in size, and the maximum activity and the maximum size is attained at day 22 of the cycle, or 8 days after ovulation. And this is again a very important question. The corpus luteum, it attains its maximum activity and maximum size at day 22 of the cycle, or you can say in other words, day 8 after ovulation. And all this while the corpus luteum, it secretes progesterone, estrogen and inhibin A. You see here the follicles, they were producing inhibin B, and this corpus luteum, it produces inhibin A. And after day 22, the corpus luteum starts degenerating, starts decreasing in size. So now let's see the hormonal interactions in the secretory phase of the menstrual cycle. After ovulation, I told you there is rupture of the follicles, and under the effect of LH, this is converted into corpus luteum. And this corpus luteum keeps on growing under the effect of LH. And this corpus luteum, we told, produces progesterone, estrogen and inhibin A. And out of these, the main hormone is the progesterone. The main hormone in the secretory phase of the menstrual cycle is progesterone. Now here there will be high concentration of the progesterone. And we told that high concentration of progesterone, it inhibits the LH and FSH. Now I'll repeat here once again. When there is low concentration of progesterone, then it causes a positive feedback effect on the LH and FSH. Whereas the high concentration of progesterone, it causes a negative feedback action on the FSH and LH, thereby decreasing their values. Now one important function of this progesterone is that it supports the endometrium, causes desterilization of the endometrium and thereby makes the endometrium secretory. So you see here that this progesterone, it supports the endometrium. And this estrogen and inhibin A, they will have a negative feedback action on the FSH, subsequently decreasing the FSH values. Now we told that this high level of progesterone, it causes a negative feedback action and it decreases the LH values. Now this decrease in the LH, it will cause the degeneration of the corpus luteum, because it was this LH hormone which was maintaining the corpus luteum. So as the LH levels fall, the corpus luteum degenerates. And this is the difference here with the pregnancy. If at all the pregnancy occurs here, then this corpus luteum will now be maintained by the HCG, the human chorionic gonadotropin, because we know that the alpha subunit of the HCG, it resembles the alpha subunit of the LH. So this HCG will now support the corpus luteum. But if the pregnancy does not occur, then with the decrease of LH, the corpus luteum degenerates. And subsequently, there will be decrease in the levels of progesterone, estrogen and inhibin A. Now, this progesterone, we know that it supports the endometrium. So, the support to the endometrium will be lost and the endometrium starts shedding. And this is what we call menstruation. Now, along with this, the progesterone, we know it is a smooth muscle relaxant. So, if there will be decrease in the values of the progesterone, then it will subsequently lead to vasoconstriction. and because of this vasoconstriction there will be release of PGF2 alpha, a prostaglandin, and this PGF2 alpha, it increases the myometrial contractions, subsequently leading to dysmenorrhea, the pain during menses. So the pain during a normal menstrual cycle that occurs, it is because of the vasoconstriction leading to the release of PGF2 alpha, subsequently causing myometrial contraction. Again, an important question. Now, subsequent to the decrease in the estrogen and the inhibin values, the negative feedback action on the FSH, that is lost, and thereby there will be increase in the FSH values, and this FSH will again act on the granulosa cells, leading to the release of estrogen, and subsequently proliferation of the deep layer of the endometrium starts. So after menstruation, you see here the proliferation of the endometrium has again started. So this was about the ovarian cycle. First, the recruitment of the group of follicles occurred. Then there was selection of a dominant follicle which grew up to 18 to 20 millimeter of size. Then ovulation occurred, and subsequently there was formation of the corpus luteum. Then when the LH levels decreased, this corpus luteum started degenerating. So this was the entire ovarian cycle. Now along with this ovarian cycle, I told you that the endometrial cycle continues. So let us see the endometrial cycle separately. Now before moving on to the endometrial cycle, I'll just remind you that this endometrium, it contains the superficial layer and a deep layer, the zona bassalis. And during menses, it is only the superficial layer that is shed. The deep layer of the endometrium, it remains as such, and the regeneration of endometrium occurs from this deep layer of the endometrium. Now moving on to the endometrial cycle, and first I told you the regeneration of the endometrium starts occurring from the deeper layer. Then under the effect of estrogen, there is proliferation of this endometrium. Then subsequent to ovulation, there is release of progesterone, and this progesterone, it makes the endometrium secretory. And as the corpus luteum degenerates, the level of the progesterone decreases. Now the endometrium loses its support, and thereby leading to menstruation. So the menstrual phase. So these are the stages